The President and I watched with great interest his speech at Notre Dame, and I thought he articulated not only a framework for our public discourse over the next few decades, but also a way of approaching these controversial issues that we truly want to find some common ground. And I know Chairman Obie and members of this committee have made a large commitment towards reducing unplanned pregnancies and therefore reducing the need for abortions and supporting pregnant women. And as you may know, Chairman Obie has in the past directed significant funds towards this purpose, and Congressman DeLauro and I have been working for a number of years to introduce legislation in the past several Congresses that would help address this issue. What is the Department going to do to try to implement President Obama's initiative and partner with Congresswoman DeLauro and I to reduce the need for abortions?
Well, Congressman, I think it's an enormous challenge that we face, and one that is something I've been working on in my home state of Kansas for a number of years, and one that I think brings together people who have varying views on abortion services around some common ground and around a notion that if we can work providing a host of services to reduce unintended pregnancies, we therefore reduce, by anybody's count, the number of abortions that are performed in this country, which is I think a goal that all of us could support. So we have a range of services in HHS that I think can help toward that end, and it's everything from comprehensive sex education, which has already been discussed. Affordable, available health care is an important piece of that puzzle. There are adoption incentives, which work along the way. Early childhood education, support for women, a range of programs for women and girls that really provide an environment where they have options and choices that are so essential to, reducing the situations that produce unintended pregnancies. So I think that I was alarmed by the recent CDC study that says we have an increase now in teen pregnancies again, having had a decrease for the last number of years. That's not good news. We know that 40% of births right now are to single parents. That's not the hallmark of good news. So there is a lot of common ground and a lot of work to be done, and I think that a lot of the assets to do that work are in the Department of Health and Human Services, and I just look forward to working with you and Congresswoman DeLauro and others, because I think this is an area where some real focused, collaborative attention can pay huge dividends in the long run.